Cassidy. My name is Kayla. I'm a UNBSJ nursing student here on my clinical rotation at St. John Regional Hospital.
Hi, nice to meet you. I'm Kelsey.
Hi. So I am here with you today to talk more about your hypertension. So what hypertension is, it's high blood pressure. Usually a high blood pressure reading would be 135/85 or above, okay? And then a normal blood pressure would be between 120/80 and 130/85, okay? Today I am going to talk to you more about how you can lower your blood pressure. I'm going to ask you a couple questions though, to just give me a better understanding of your lifestyle and helps me understand what is the best approach to take when trying to help you lower your blood pressure, okay?
Yeah.
So the first question I'm going to ask today is if you can tell me more about yourself and your medical history.
Yeah, for sure. So I'm 30 years old. I'm a university student studying part-time to become an engineer. And currently I work at Boston Pizza full-time. I also live with my parents, and I'm just kind of doing that to save up on money right now and pay for food and bills. And I also have a student loan right now as well. I'm relatively active. I like to play soccer a few times a week, and this really helps to decrease my stress levels, especially being a student at school. And it's something that I really do look forward to every week. As for my health history, I did have surgery on my knee in 2020 from a sports injury, and I also suffer from asthma, which I was diagnosed with at the age of 4. And then just recently being diagnosed with high blood pressure.
Okay, so that's really good. So you like soccer. That's a good thing for staying active and working hard towards your learning goals while working, and you have something that helps you reduce your stress, because sometimes stress can elevate your blood pressure a bit or increase your blood pressure a bit. And being able to maintain your stress will help lower your blood pressure as well. That's also a big thing. But it's really good that you play soccer and maintain being active, because that's a big thing also with lowering your blood pressure as well. And with your previous health history, you appear to be relatively healthy. That's really good. Are there any foods that you may be allergic to or foods that you dislike?
Not really. I don't really have any allergies that I know of, but as for like foods that I don't like pickles, I don't like olives, but other than that, I pretty much eat like anything.
All right.
Yep.
Well, that's good. You don't have many restrictions as to what you can eat, which is a really good thing. What type of meals do you normally eat in the run of a day?
So usually I make meals for myself, and usually pick like something that's really quick and easy to make because I'm super busy. So for example, at breakfast time, I would eat a banana, or I'll buy a bagel from Tim Hortons, like a bagel belt with like the egg and the cheese and lettuce. And for lunch, I would have a peanut butter sandwich or a cup of fruit. For supper, I might have like a frozen pizza or Kraft dinner or cooked spaghetti. For snacks, I'll typically have frozen fruits or yogurt.
Okay, perfect. It seems like you like a variety of foods.
Mm-hmm.
All right. Are you okay with changing what you would normally eat in the run of a day to help lower your blood pressure? Would this be something you would consider?
Yeah, this is definitely something I would like to do, because obviously I want to eat better with this diagnosis of hypertension, and I feel like I'm just having a really hard time figuring out what foods are good to eat with hypertension, and yeah, I'm just open to whatever considerations that you have.
Okay, perfect. So this is something I can help you with today for sure. That's good. This information is helpful for me to better understand your lifestyle and what we can do to work together to help you lower your blood pressure and keep it regular. I'm just going to explain now to you the importance of blood pressure being regular and what changes we can do to make this happen. So with blood pressure being high, there's a couple lifestyle changes that can be implemented that will help lower it. But today we're going to more so focus on food modifications, like changing your food intake.
Okay.
Just because where you're relatively active, you're not a smoker, you're able to reduce your stress and stuff like that. my main concern is the food portion of it.
Okay, yeah.
So one of the main diets that are consistent with hypertension is the DASH diet. So the DASH diet stands for Dietary Approaches to Stop Hypertension. The diet includes nutrients that help control your blood pressure, and then nutrients that you want to veer away from that will also help decrease your blood pressure instead of raising it. Okay. So these ones that you want to stay away from are salt, sugars, and trans fat, or saturated fat, sorry. So now I'm going to explain to you the food groups that are included in the DASH diet and the servings that are recommended and some examples of servings and stuff like that, okay?
Yep.
So the DASH diet consists of mainly grains, which are whole grains, well, mainly whole grains. So you would have typically 6 to 8 servings per day of grains. Fruits, which are 4 to 5 servings per day. Vegetables would be 4 to 5 servings per day as well. Non-fat dairy foods would be 2 to 3 servings per day. Lean meats, poultry, and fish would be less than 2 servings per day. And then nuts, seeds, and beans would be 4 to 5 servings per day. So the main thing I want you to focus on for this is what food groups that you should be eating. I also have a sheet here that identifies what food groups that are consistent with the DASH diet and what to kind of limit away from. Okay, so I'll leave that with you today to take home so that you kind of have a rough idea as to what to look for in the DASH diet and what to avoid. Okay, the next thing I'm going to explain to you is right here. I also have a meal plan that is consistent with the DASH diet that will help you. You don't have to follow it, but it's just the idea of what you can eat in the run of the day that helps you with the DASH diet, okay? So, for example, you can eat for breakfast 2 boiled eggs, 2 slices of turkey bacon with a half cup of cherry tomatoes, half cup of baked beans, and 2 slices of whole wheat toast, plus half cup of fresh orange juice. So that would be consistent with your breakfast for the DASH diet. That's just kind of an example of what you can eat in the DASH diet. So there's a lot of other meal preferences you can make. I just want to be sure that I explained that portion clearly to you. Can you explain it back to me so I can be sure that you did?
Yeah, for sure. So you explained to me the DASH diet, which stands for Dietary Approach to Stop Hypertension, to Slow Hypertension.
Yep.
And what I should really focus on is reducing my salt and my saturated fats and my sugar intake. And with this DASH diet, there's 6 different food groups that you had mentioned, and I think they were your grains, your fruits, your vegetables, like your meats, like your chicken and your fish, and your nuts and your beans. And you went over
There's one more.
Oh, your milk products, so your low fat or your non-dairy.
Exactly, perfect.
And so I think you said it was 7 to 8 grams grains, per day for serving.
Yep.
And 4 to 5 fruits per day. And I think it was the same for vegetables as well, 4 to 5.
Yep.
And then meat or fish would be 2 or less servings per day. And then your nuts and your seeds and your beans would be 4 to 5 servings within a week. And then you can have 2 to 3 servings per day of your low fat milk or your non-fat dairy products.
Yep, that's perfect. So I understand there's a lot of information that may be a lot to take in at this time, especially changing your daily food intake. So it seems that you understand this portion really well. And I just want to explain to you more about how you can gradually change your food intake with the DASH diet. So with the DASH diet, usually what is the recommended sodium intake within a day would be 1,500 milligrams per day. So instead of starting straight at the 1,500 milligrams per day as DASH diet recommends, you can start off by starting at 2,300 milligrams per day.
Okay.
And then you kind of adjust yourself as you get familiar with the DASH diet, okay?
Okay.
So other helpful tips that will help ease you into the DASH diet would include choose fat-free over low-fat dairy products, cook vegetable oils instead of margarine, limit your high intake of sugars, salt, and saturated fat, choose low sodium products, limit processed foods such as cheese slices or deli meats. Important to make note that some bottled water also contains salt in it. So when you're looking at the food label of the bottle of water, just look to see if there's salt intake in that as well, okay?
Yep.
So to enhance your flavor of certain things, instead of adding instead of adding salt, you can add things like lemon or garlic or stuff like that to kind of increase the flavor in your foods instead of adding that
Okay,
added
perfect.
salt. Okay, so I'm going to leave these tips with you as well. So I want to be sure that I explain this portion correctly as well. So is there any way you can explain it back to me to ensure that I did?
Yeah, so you had talked about the importance of reducing my salt, my sugar, and my saturated fat intake, and that I should try to look for fat-free dairy products over low fat, and that I should try to limit my processed foods such as my meats and my cheese. And I should try to carefully read food labels to make sure that I'm not consuming too much salt, saturated fat, or sugar. And instead of using salt for seasoning, I can use garlic, which I love, or lemon juice.
No, that's perfect, exactly. And you're doing well with understanding this material so far. So I'm going to start to explain about nutrition labels, if that's okay. Because it is important to understand that what a nutrition label consists of, and to make sure that you are getting enough of the foods recommended for the DASH diet, and that you know how to decrease your consumption of salt, sugar, and saturated fat. Are you familiar with how to read a food label, or what would you normally focus on when reading a nutritional label?
So kind of like I know where to locate it, and sometimes I'll skim it, but other than that, I find them kind of confusing, to be honest, and like a little bit intimidating. So yeah, I would definitely love to learn more about it and what I should be looking for on a food label.
Okay, perfect. Yeah, that's fair. They can be kind of confusing. Okay, so that's good. So while fresh fruits and vegetables, whole grains, and other less processed foods are important to a healthy food intake, you can make smart food choices with processed food products as well, when you know what to look for.
Okay.
So when you're looking at a nutrition label, it's important to look at items that are lower in sodium, saturated fat, mainly, because this is the most important on the food label as it pertains to the DASH diet. Here I have some information, an information sheet that kind of breaks down how to read a nutrition label as it pertains to the DASH diet, okay? So the most important thing that I want you to know is when looking at a food label, it is important to focus on sodium and fat, which I just previously said. And when you're looking at the food label, look at the sodium, look at the daily percent value, and then look down at the sodium aspect, okay? So typically you want your sodium to be 5% or below the daily value percentage. So right here you have low sodium canned diced tomatoes, and it says 1% daily value compared to canned diced tomatoes, the regular, and it says 6% of daily value. So the reason why I have these two nutrition labels here is because it's always important to compare two similar products to kind of gain a insight on which one you should pick. So between these two food labels, which one would you pick?
I would go for this one because this one has 1% of sodium and the second one has 6%.
Perfect. Yep, that's right. So the other thing is too, when you're looking for fat products, like saturated fats. You want to look for products that are fat-free, low saturated fat, low fat, reduced fat type things.
Yep.
And then when you're looking at a food label for sodium, just look for things that are sodium-free or salt-free. Very low sodium, reduced or less sodium, and stuff like that. So your sodium is your salt. Other thing I want to point out too, so when if you see the daily percent value and it's above 20%, that's very high sodium intake. So you kind of want to veer away from that because that will definitely increase your hypertension. Okay. So I'll leave that with you.
Great, thank you.
Okay, you're welcome. So we've gone over a lot of information. In your own words, please review what we have talked about in this portion.
So we went over nutrition labels and how to read them. So mainly I should be focusing on looking for foods that have less salt and less saturated fat. And my goal or my aim for sodium, I think you said, is for 5 or lower than that, 5% or lower. And for foods 20% or more, that's like considered really high for sodium, so I should try to avoid that. And yeah, so the things that I should be looking on food labels is something that states low sodium, salt free, fat free, low saturated fat, low fat, and yeah, and also you talked about comparing 2 different items to see the nutrition facts, because for example you used Candice tomatoes and different brands, and I should always be looking and comparing which one, because one of them may contain lower saturated fats or lower sodium than the other.
Right. No, that's perfect. So it seems that you understand the material I have provided with you today. I will leave these information sheets with you just to help you following the DASH diet and to use as guidelines. It's also important to continue to monitor your blood pressure weekly. Do you have access to a blood pressure cuff?
So I don't actually own my own blood pressure cuff, but it's definitely something that I want to invest in now that I've got this diagnosis.
Okay.
But I live next to a pharmacy. It's like a 5-minute drive down the road, so I can just drive there in the meantime to get my blood pressure taken.
Okay, perfect. Just because it is important to continue to monitor your blood pressure while doing the DASH diet, just to make sure that it's actually working and lowering your blood pressure. So another important thing to remember is when you should contact a doctor in the case of emergency. So it is important to call your doctor if you're experiencing, if your blood pressure reading is above 180 over 120. That's very high and concerning. So it's important to call your doctor if you have a reading such as that, and if it's accompanied with dizziness, lightheadedness, headache, stuff like that. Just make sure you call your doctor if those symptoms occur.
Okay.
Okay. So do you mind explaining to me what signs and symptoms you would call your doctor about?
Yeah, so if my blood pressure is running really high, for example 180 over 120, I think you said, that sounds really dangerous, so I should call him definitely if I see that. And if I feel faint or dizzy, or if I get a really bad headache.
Perfect. Yep, exactly. So the most important thing I just want you to understand and to take home with you with all this information, the main thing is limiting the saturated fat, sugar, and salt intake in the diet, and what servings you need per food group to provide you with the nutrition you need to lower your blood pressure. So that's the main stuff I kind of want you to take home from this, and kind of like how to read food label properly. For your next follow-up appointment, it's a month from now, with your family doctor. If you have any additional questions where you need further clarification, please don't hesitate to call your doctor's office or myself for any additional information you may need to help you through this lifestyle change, because I know it can be challenging to change from one previous lifestyle to changing to a different lifestyle eating, right? So I just want you to know that we are here in case you need any further clarification. Do you have any questions that you would like me to address right now, or?
Nothing that I can think of the top of my head. Honestly, I found this was really informative, and I'm really happy that you gave me this because I really like things that are visual, and I like that it's in color, and I'm definitely gonna make photocopies of this and carry them around with me. But yeah, with this information that you've provided me, it's gonna give me guidance on what I need to do and to lower my blood pressure, and it's nice to have in case, I forget something. And if I think of anything after I leave today, or if I have any questions in the future, I'll definitely contact you or my doctor. And I really appreciate this. This has been super helpful.
Okay, perfect. Well, I think that's everything from me today. Hope you have a good day.
Thank